One of the big points in this, Dr. Judy, is that she was bipolar type 1. So what does that mean in your mind?
Well, there's two types of bipolar diagnoses. There's bipolar disorder 1, which is the more severe type, and then bipolar disorder 2. Elisa most likely had bipolar disorder 1 because she exhibited psychotic features. That doesn't really come with bipolar disorder 2. In that condition, people are hypomanic. They have a few days where they seem a bit more agitated. They might have more goal-directed behavior. They might be a little more impulsive, but it goes away after about 3 or 4 days most of the time. When somebody has bipolar disorder 1, not only can they manifest psychotic features like hallucinations and delusions, but they are much more impulsive than people who are bipolar disorder 2. They tend to do very grandiose things, believe that they might be superhuman. And this can last for days, if not weeks, if it's untreated. And when you look at some of the other evidence around Elisa's behaviors around that time, she went to a taping of a talk show and she wrote this long rambling letter and demanded that the security and the staff give that letter to the host. Then she was escorted off property. She was staying actually with a couple of roommates at first when she arrived at the Cecil. They just paired them together because it would save money for all these young people. And she was putting Post-it notes all over their beds and all over the room, writing things like "get out, go away." So she was probably already manifesting some of that paranoia. And I think when you think about that and you look at that in the lens of bipolar disorder 1, it makes a lot of sense that perhaps she had already started to manifest that manic episode for maybe even a couple of days before she actually died. And my theory is that she thought somebody was after her because that was her delusions. And she ran to the roof trying to hide from them, trying to save her life. She saw the water tank. She thought maybe it was a good place to hide. But once she got in, there was no way to get out. There's no ladder in there, and the water is being used by the residents of the hotel. So the more the water is being used and the more it went down, the harder it was for her to actually get back up. And I believe even the fact that she shed her clothes would have been a possibility. If she's trying to get out and she's trying to shed this dead weight, she's trying to save her life. I don't believe this was a suicide. I believe she wanted to live, Dr. Orden.
Well, I think you really have peeled back the facts, and I agree with your diagnosis and how this event played out. I mean, clearly she was on a litany of medications that would be typical of somebody with bipolar disease type 1. It was shown that she had not been medicating herself. She was clearly manifesting psychotic behavior and was trying to hide, was trying to feel safe, quote unquote, and ultimately led to her demise.